Hi, everyone. My name is Debbie Churgai. I'm the Executive Director of Americans for Safe Access. Thank you for being here today. Today's webinar is a collaboration between Americans for Safe Access and Holistic Caring. So if you are not familiar with Americans for Safe Access, we are the oldest and largest national organization of patients, caregivers, medical professionals, scientists, and concerned citizens promoting safe and legal access to cannabis for therapeutic use and research. We were founded in 2002 as a vehicle for patients to advocate for the acceptance of cannabis as medicine. And nearly 20 years later, we are still advocating for the acceptance of cannabis as medicine. So advocacy is still so important in this space, and it's something that's very much needed. And we are lucky to partner with orgs like Holistic Caring that share our same mission to help educate and end the stigma and misinformation surrounding cannabis. We have here today Elisabeth Mack. She is the founder of Holistic Caring. Holistic Caring was founded in 2016. She was a nurse for 35 years, and she began by healing herself from 20 years of orthopedic issues that conventional pharmaceuticals could not help her with. She opened a private practice to navigate the system for patients, teaching other nurses along the way, and developing a comprehensive curriculum to toolkit of businesses, building patient teaching forms and presentations so healthcare professionals can plug and play. Before we start the webinar, I just want, and you'll hear from Elisabeth soon, but before I want to start the webinar, I want to give a quick mention to some of ACE's initiatives right now. As I mentioned, we are an advocacy organization. We have a national campaign right now called No Patient Left Behind, and that focuses on the gaps in access that patients still face around the country, even in states with robust medical cannabis programs. We also have our annual patient feedback survey is out right now, and we would love as much support and feedback as we can get from everyone from across the country. This short survey helps us produce quality analysis, and it helps us potentially change laws and regulations within and across the states to better serve the needs of patients. So please, if you have a chance, please take just a few minutes to fill out that survey. We also have a petition out right now, and this is asking the White House and Congress to stop penalizing cannabis consumers like Sha'Carri Richardson, who was, you all probably know, was denied a chance at a medal this year at the Tokyo Olympics, simply for her cannabis use, her legal cannabis use. So please sign our petition so we can put a stop to patients and consumers losing out on opportunities simply for their legal cannabis use. So today's webinar will first include 2 patient interviews with Jessica and Rick, 2 cancer patients. You will hear their amazing stories and how cannabis helped in their treatment journeys. These interviews were pre-recorded, and so just a quick disclaimer that the video quality of the second interview with Rick, it's a little bit spotty, but stick with us because it gets better. But we just wanted to let you know that it's just a little bit fuzzy in places. After the patient stories, we will go into the educational segment of the webinar. We will hear from the Holistic Caring founder, Elisabeth Mack, about how cannabis works as medicine and how it can help symptom relief with cancer patients. Then Elisabeth and I will hop on at the end of the webinar to answer any questions. So please feel free to ask as many questions as you want during the webinar. You can put it in the chat function and we can answer as we go along. There is also a button at the bottom of the screen that says Q&A. So if you want to ask a question anonymously or just privately so that only the presenters will see it, feel free to ask questions that way as well. And lastly, before we begin the program, which will just about to start in a minute, I want to give a great big shout out and thank you to our sponsors, Dr. Bronner's and Weed Maps. We cannot do any of our work without the help of our sponsors, members, and donors. If you are interested in sponsoring any of our upcoming webinars, please reach out to us. I will put the info of how you can reach out to us in the chat. But please, thank you, Weed Maps and Bronner's. We hope that you support their businesses as they do support us. And now, on to the program.
Hi, my name is Elisabeth Mack, and I'm the founder and CEO of Holistic Caring here in San Diego, California. Tonight, I am pleasantly able to introduce Jessica, and we're going to talk about the ability to use cannabis for cancer treatments and how that might work interfacing with conventional care and the progress that we're making here in 2021 and all the ways forward that we need to go together. So with that, I'm going to ask Jessica a few questions, and we hope that you'll understand that this is something that we are bridging the gap between conventional and cannabis therapeutics, and we're not there yet, but we're hoping to influence other people to change the paradigm of healthcare to include cannabinoids as a treatment option. So with that, welcome, Jessica, and thank you for joining us today. So please tell us about your diagnosis, your conventional treatments, and what that was like for you. What were you feeling when you were diagnosed?
It's an overwhelming feeling of fear because we associate cancer with death. At least that was my first thought. And then learning that I had cancer from a mole that grew out of control.
What type of cancer?
Interior environmental melanoma. And so yeah, it's very, very frightening.
It can be very aggressive.
And it was very, very aggressive. It most certainly was. And because of the mole, having a PET scan, we learned that I had more cancer. It was in my lymph nodes now. Mm-hmm. At least one of my lymph nodes.
So what was the course of treatment? What did they do?
I was diagnosed on the 1st of October, scheduled surgery on the 17th, had surgery to remove the mole and a mass in my lymph node. And I fought so that they would not remove the lymph node from my leg, because I already knew what I was going to be facing if that happened. And I'm a race walker, so that was a difficult choice. But I chose to keep the lymph node, knowing that I was going to have to start chemo right away.
Okay, so surgery and then chemo was going to be scheduled after that?
Yes. Didn't happen because we learned that my insurance didn't cover that, and so it was going to be an out-of-pocket expense. This is October. I can apply, but I can't start even using the new insurance until January. So that's a long time being scared and no treatment, and knowing that cancer is aggressive and it just continues to grow. So I had to do something. I had to do something over nothing. Mm-hmm. And I remember meeting you at one of the lectures you gave at the San Diego Garden Club. And dug up your number. Couldn't find it because I was going mental, but I got your number, gave you a call, had a consultation, listened to everything that you had to say. I was very open to it because to me it was treatment, and I was still moving forward in a way where I can continue to fight cancer mentally. That allowed me to sleep. It allowed me to genuinely start facing every day in a very different way, as opposed to just having the cancer and doing nothing about it.
Okay, so surgery was taken care of, and I remember meeting you at that juncture.
Yep.
And then introducing you to cannabis and to cannabis oils specifically. Mm-hmm. Were there other people that were influencing you with respect to cannabis? Try this?
No. No,
Okay.
not that way. No, this was the first time I had learned of cannabis for medicinal purposes.
Were you using cannabis recreationally before?
Yes,
Okay.
on and off throughout my life, my adult life. Yes,
I remember sometimes you would chill out with that.
yes,
But this was different to introduce oils.
yes. It was different, and it also was for pain management. I had surgery years ago, knee surgery, reconstructive surgery on both of my knees, and Tylenol with codeine became my best friend. So knowing that I would have to take my oxy pill every 3 to 4 hours was frightening. So having the oils as an alternative for pain management on top of everything else was a big relief, because I knew that that was not addicting the same way as oxy was. And I did fight my oncologist on that, because he said the oxy is cancer medication.
Cancer medication.
And we know that it doesn't cure cancer, and we know it's just to manage the pain, but I was very, very scared of becoming addicted.
And so with respect to cannabis and treatment, so we talked about how you can take these oils and high CBD and in the day and high THC in the evening. And I did talk to you about how these have preclinical data and how they might be able to shrink tumor cells, but also how we can use them for symptoms. So you mentioned pain, and then talk about other symptoms that you might have been able to control with the cannabinoids as opposed to all of the pharmaceuticals that they put in front of you.
Well, as we know, there's gamut of emotions that's attached with cancer. Anxiety. I had a panic attack, and again, the oils, that's what calmed me down as I try to talk myself through it, as opposed to calling 911. But I was experiencing a lot of things I had never experienced in my life. And it was nice to use my oils instead of just another pill that was going to sedate me.
And so for pain, for anxiety, and then for sleep.
Yes.
Yeah, I remember you were
Yes.
having trouble sleeping initially because of all that fear.
Yes.
And how am I going to change my life, and what's next, and what's around the corner, and insurance, and your job.
That's right. And when you don't sleep, you don't function. So you just, all of that comes together. All of it comes together to allow you to function. And it is. It's like a team of people working on you.
So when you got your insurance back in January and things were rerouted, tell me about the change in course with respect to chemotherapy.
The change in course was night and day. We went from the new oncologist scheduling chemotherapy starting on February 14th, sent me in for a PET scan to see exactly if it was the same finding as the previous oncologist had found. And what he learned is that the tumor and the cancer in the lymph node had shrunk significantly to the point where he canceled chemo and we went to Keytruda. So that was a huge difference, and here we are a year later after being on Keytruda. My last PET scan showed that I'm cancer-free. I'm in remission.
Congratulations.
So he does, my oncologist does believe that it was a combination of everything. The diet, the vitamins, and absolutely all the oils and everything that I used of cannabis products.
Wow.
And I agree.
So what did it feel like to you to cancel chemotherapy?
Oh my gosh, it was so hard to even imagine going through it, that not having to do it. You just can't believe it. You're in disbelief for a while. That's for
relief.
sure. Very much so. because your life is going to be completely different. I could function.
Yeah.
And that was important because I'm a daycare provider and I still work a 10-hour day with children. So having my energy is very important, obviously.
So the oncologist then viewed cannabis as part of the treatment plan tool in the kit, and was he validating that it was significant?
Yes, as a matter of fact, my last appointment with him, he said, you are welcome to go back to any of your oils, your herbs, any of your treatments, anything that made you healthy and changed your life. Absolutely.
Was he leery of using cannabinoids together with the immunotherapy, the Churgai?
Yes.
Yeah.
Yes. There's not enough research.
Right.
Was his understanding, and I agree, since we don't have enough research, I had to respect what
And we
I was-
adjusted things
what-
down.
Yes.
Right. Yeah. So they were elevated for a while as far as dosing, and you got up to with good Anselda's oils, by the way, some of the finest oils in the world that you were able to buy here in California, thank goodness. But downshifting that when immunotherapy was added to the treatment plan, and that's an
Right.
important thing to know, because we don't know, and you don't want to potentially suppress immune function when we're trying to raise it, and
the money I spent on the treatment was still less every month than what I'm spending even now on my monthly insurance payment.
yeah.
Yet then my insurance doesn't cover it,
Yeah.
but I can get a state license so that at least I can get a little discount.
Yeah.
So on some level, they're starting to recognize.
So it's good to keep the medical marijuana card to get the discounts
Yes.
on the taxes for the medical marijuana.
Absolutely.
Yes, absolutely. So tell me, with respect to being a daycare provider, did you tell any of the families that you were taking care of the kids, that you were going to be using cannabis oils?
I felt an obligation to fully disclose because they're trusting me with their children. And so once I educated them and let them know when I'm off and I use my oils, and I'm not functioning, but I'm also not caring for their children. And then in the morning, you have a different oil that's going to help balance everything so that you can function and you could do your job and provide the best care for their children.
Yeah.
And so yes, I think that full disclosure is very important.
Did you ever feel too impaired to take care of anybody?
No, never ever did.
Good. Yeah, because you got used to it, and you start low, you titrate up slowly, CBD in the day, THC after dinner. So is there anything that we have not talked about that might help other people that are making these decisions that you want to tell the world?
I think I'd like people to know that when you're at a loss and you don't have insurance, that there are other avenues. Not all the doors are closed for us, and that this is still affordable. And that just like cancer doesn't discriminate with any age, this also is very helpful for people of any age. And so it's nice to see that people are so much more open to it, knowing the benefits.
Well, thank you, and God bless you.
Thank you.
Thank you. Hi, I'm Elisabeth Mack, and I welcome you to another installment here of the Cannabis for Cancer and Treatment with patients utilizing cannabinoids as part of their treatment plan. I am blessed today to be joined by my dear friend and client, Rick, and we're going to be talking about his journey and how he found cannabis as an option for his care. So, hi, Rick.
Hey, how you doing?
I'm good. Thank you so much for joining us and for agreeing to talk with me and this segment about your specific journey and how cannabis was part of it. So with that, tell us a little bit about the timeline, what you were diagnosed with, what the options were, and how you really felt with that course of care that was laid out.
Yeah, really happy to be here and happy to help contribute to this. Thank you for having me. I was diagnosed in early February of 2019 with very advanced stage 4 metastatic non-small cell lung cancer. Upon diagnosis, I already had multiple metastases, brain metastases, bone metastases, over a dozen metastases overall. For those of you that know anything about non-small cell lung cancer, that's a very serious diagnosis. The first oncologist that I met, I was basically told to expect about 5 months, and I was supposed to go home and get my affairs in order. And at that point, it's basically palliative care. Everybody kind of knows that. I didn't really like that idea at all, and don't accept that. And we were pretty naive at the start. Didn't really know anything about anything, and started off completely in the conventional oncology department at the local clinic, and started out with some basic things, all the normal MRI and CT and PET scan and all that stuff. And first thing that we did treatment-wise was surgery on the spinal lesion, because it was the neurosurgeon saw that the lesion was pressing up against the nerve roots in the spinal cord and could possibly put me in a wheelchair and be paralyzed from the waist down. So did a surgery right away, and they followed that up with a short course of targeted radiation, and then went on to a targeted therapy drug. A lot of people are aware of this. Tagresso is the name of it, or osimertinib. Pretty successful targeted therapy drug. So that's basically where we started.
And that was in the beginning of 2020, and then did you
19.
2019? That's right.
Yeah.
Yeah. And did you get second opinions? How did you decide to widen the scope?
Yeah, on day one, it's really overwhelming. And I'm sure you hear this from a lot of cancer patients when you're first given that terminal diagnosis. It's absolutely overwhelming and traumatic. But we very quickly figured out that straight conventional route didn't offer a lot of options, and it didn't feel very good to us because all the treatments are very destructive and toxic, and they basically are cytotoxic to your body as well as the cancer. And that's when we started looking more and researching more and talking to more people. Integrative therapy was absolutely not discussed at all by our conventional oncologists, as they don't. And it took a lot of audacity to make those phone calls and travel, go to different clinics, meet different doctors, and learn about all this stuff. But eventually we did, and very happy that we did.
That became your job, to find a way to heal and a way to not only live, but you were determined to thrive. And so tell me about the integrative oncologist that you found and how that changed things.
Yeah, it's really, really interesting. And it's kind of a message that I want to get out, because I assume that there's a lot of other newly diagnosed cancer patients that are watching this. One of the biggest things that I want to tell you is you have some time. Newly diagnosed patients are pressured really hard by that first oncologist they meet, and they create this sense of urgency that overwhelms you. And what I'm here to tell people is you have time, almost always, you have enough time to talk, to do research, to ask questions, to get that second opinion, that third opinion, or that fourth or fifth or sixth opinion, whatever it takes until you find what you need. And I really want people to know that. And I really want people to understand the difference between an integrative oncologist and a conventional oncologist. A lot of people don't even understand this. The best analogy that I can give, I like explaining things with analogies to people, is let's take a different disease. Cancer is really complex. Let's take something relatively simple like high blood pressure. If you go into your local clinic, a standard conventional clinic with high blood pressure, all they're pretty much going to do is get you on some sort of high blood pressure medication first. That's the first thing they do. They don't really look at what caused your blood pressure to be high. They don't look at what's wrong in your body, and they don't try to fix that. They're simply band-aiding over a symptom. That's what conventional medicine does. If you go to an integrative doctor or an internal medicine doctor or somebody who's more holistic and integrative, you go in there with high blood pressure, they're going to look at everything. Like, why do you have high blood pressure? Is it your diet? Are you overweight? Is it your lifestyle or something else? They look for the root cause. That's the fundamental difference between conventional oncologists and integrative oncologists, and it makes a world of difference in how they approach treatment. But I also really want people to know that this is not an either-or scenario, in my opinion. There are people who think that they can do everything just alternative or just conventional, but I think that's absolutely not the case. I've networked with and gotten to know dozens and dozens of long-term survivors like me, and every single one of them, without fail, is embracing multiple doctors and multiple modes of treatment. You never, almost never, find a long-term survivor in remission who's accomplished that with one doctor, one conventional therapy, and one drug. It just doesn't happen. It doesn't work that way. So I encourage people to ask those questions and find more help.
Yeah, thank you for that tip, because a lot of people, they just trust that first source, and there's so much more that you need to open up the blinders and look beyond and take this into your own hands, because this really is about your own life and well-being. So when you found the integrative physician and you started working with them, exploring these root causes and looking at other modalities, was cannabis cannabis oils an option that they brought up? And when you decided, how did you find out about using cannabis oils first? And were even the integrative oncologists supportive of that choice?
I don't want to hurt your feelings, but I'm here to be honest. Absolutely, none of the conventional oncologists, of course, is all interested, and none of the integrative or holistic people that I worked with even suggested it. It wasn't even on the radar at all. The different dynamics, once we got started on it and started working on it, I can have an open and free conversation with my integrative oncologists about it, and they embrace it now, and they encourage it, and they support me in it. But the conventional doctors, absolutely not. You can't talk to them about it.
Well, so how was it brought up, and how did you decide to try oils and integrate those into the plan?
Am I allowed to say names in this interview, or are you trying to keep names of people?
You can use first names, but yeah.
I'm just going to let her fly, and you can edit them out.
Okay.
Because I love the guy, and he deserves the props. John Malonka, he and his wife started the United Patients Group. He did an interview, in the name of the series was The Answer to Cancer, that Patrick Gentempo and Jeff Hayes did. Absolutely wonderful docuseries, and Melanoma did that interview in there, and that's really what got me started on it, and then started doing more research. Because that's the way our whole therapy has gone. We don't just jump off of bridges left and right. You know, we hear about something, and then you talk to people, and then you do research, and then you meet fabulous people like Elisabeth, who can help you guide through the process, and that's really how it got started. And then the work that I did with you really helped me get it dialed in and working.
Got it. Yeah, I remember connecting with you through United Patients Group, and love John Malanka and all the work that he does to advance this. So you started oils, and tell us about what you were taking and how you were taking them, and really how you decided to step up the variance in the dose, and what you were treating with respect to looking for a curative path, but also with respect to helping manage some symptoms of pain and anxiety and sleep and depression and adjustments.
I was kind of an interesting case, I think, because a little different than most people. I think most people that I've talked to end up starting cannabinoid therapy dealing with some kind of a symptom, whether it's nausea or pain or sleep. I think you'll remember that wasn't the primary start for me. I was really looking at this as one more thing to add to the therapy that could maybe push us over the edge and help drive this cancer down. So we were really focused on the cytotoxic aspect and the tumor debulking aspect of the THC. There were a lot of other side benefits that came along with it. It did improve other symptoms and other problems that I was having in treatment. So there was a lot of side benefits that way. The reason why I chose oils and went down that route, it was kind of twofold. I have to confess that I've kind of had a lifetime aversion to drugs and tobacco and alcohol. It was just the way I was my whole life. I was very, very anti-drug, and the thought of putting what in my state is an illegal substance in my body was honestly terrifying. It wasn't what I wanted to do. But when you're fighting this battle with cancer, you take something that works as long as the side effects are not bad, and the adverse side of cannabinoid therapy is basically zero. So there's no downside risk. It just made sense to go ahead and try it. The reason why I went to the oils instead of other routes more has to do with what I learned from you and other people and other resources on the effectiveness, because from what I've understood, for example, if you're smoking a cannabis product, the heat associated with the smoking degrades properties that we need for cytotoxic activity. You still get the psychoactive high, which is great for some people, but if you're focused on the debulking, it's not going to be the best route. And the same with the edibles. The research shows that the breakdown in the stomach and digestive system and liver changes the metabolites, and you lose a lot of the efficacy. So going with the direct oil route made a lot of sense to me, and it's easy to administer for me. And I didn't want to be smoking products or hauling around gummy bears or whatever. So it just worked really well for me.
Well, I remember, setup 101 and getting you started, and you were averse to being high. You didn't want anything to do with that. You wanted something clean and easy, and something that you could measure and titrate and have a sane, rational approach to. You weren't the guy that wanted to go to the dispensary and get a couple of joints and just feel better, or an edible and go to sleep. You were always wanting to focus on healing, and so I remember we started off in CBD during the day and THC in the evening, just nice and low and slow, getting you to go to sleep, and and not have to deal with the psychoactive consequences. And then adding in the acidics and CBDA and THCA and CBG, and really working with your cultivator and your processor to make oils for you that were going to be, really specialized in anti-cancer terpenes and limonene and humulene and myrcene and beta-caryophyllene, and really focusing on treating this as medicine. So yeah, you were really targeted on that approach.
It's a hard thing to do, though. And, that's the message that has to get out there to people, is that this is not like going to the clinic and getting an antibiotic prescribed to you, and the doctor gives you a prescription and you get your 100 milligram dose and you go home and you're all done. It's not like that. It takes teamwork between a patient and a family and somebody who is an expert that knows what they're doing to figure out these blends and to gradually work up the therapy to the right level. It just takes a little bit more effort, and people need to know that. It's not a bad thing, but they need to know that so that they're prepared for it and avoid failures, because I've run into a number of cancer patient friends of mine who have tried doing cannabinoid therapy without getting help from somebody like you, and without having a good oil processor who can make quality oils. And it doesn't work very good for them. They usually end up quitting. It just doesn't work.
Which is, why we need to advocate for descheduling and research, and for every patient to have a nurse and a clinician to help guide, and for all oils to be tested and to have certificates of analysis so we know what's in them and how to dose properly. And so, you're bringing up so many good clinical pearls to tell people in this audience. So let's just talk about, where you're at now. It's obviously 2021, July. Thank goodness, you started this journey at the end of 2019 with me and finding the cannabis oils, and it's been a while. So tell us where you're at now. You're doing really well.
Yeah, we're doing fantastic, and I'm really grateful for it. We have a lot of different people to thank, but the cannabinoid therapy is one piece of the puzzle. I really believe in this integrated concept where everything works together. Where we're at today, all of my metastatic lesions are cleared up. My brain is clear. All the mets in my lung and lymph node and bones and other areas of the body perfectly clean. My lab values have improved to like almost normal. I have a very small remnant of our lung primary is still left. It's like the size of a pea. I can't technically be called an NED yet or technically in remission yet, but gosh darn it, I'm healthy and strong and I'm capable of doing just about anything. And I ask anybody that's watching this to find patients who are almost 3 years into intensive treatment in this stage of disease, who are as strong and healthy and happy and well adjusted as I am, who are doing it through conventional means. It just doesn't happen. It takes all these pieces together.
So coupling the Tigrisso, which you've remained on, and the other conventional things, along with the other integrative therapies, your vitamin C and hyperbaric oxygen, some of the other supplements that you've got a very big list of supplements, and other targeted therapies, working with your integrative oncologist, and wrapping it all up, and adding the cannabinoid oils. And we'll figure out a maintenance dose when you do get that NED, because I know it's coming. And so, what closing thoughts would you like to have, and what would you say to anybody else who's newly diagnosed and looking at options?
A couple of things. Specifically on the cannabinoid therapy, I beg any that you get some help. Don't try to do cannabinoid therapy alone. I've watched too many people do it, and I've seen them fail dismally. And those who get some help and get some guidance and some support, they do really, really well. A couple other things that I'd like to tell every newly diagnosed cancer patient, we kind of alluded to them earlier, but please take the time to do research. Please take the time to get second, third, fourth opinions. Please find an integrative oncologist. Keep your conventional oncologists, have them work together. This is an and situation, not an or. You will always be most successful if you do it as an and integrate as many different supportive therapies as you can. And like you said, the list is really long, but they all benefit you, from high dose IV vitamin C to IV curcumin to hyperbaric oxygen to hyperthermia, energy medicine, Reiki, meditation, acupuncture, supplements, off-label medications. The list just goes on and on and on. Find the modalities that fit you and resonate with you and put them together, and it works amazingly, and you can have a different outcome.
Well, thank you. And you know what? I'm going to resubmit your list. So send me your list, and we'll put that in the show notes of the webinar of just some of the other supplements and integrative therapies that you've added. And some people can use that as a guidepost and pick and choose some of the ones that might be accessible to them. And yeah, and in another week, you're about to go on a backpacking trip. You want to close with that note of hope, telling people what you're about to go do?
I do, because I'm really happy about it, and it's a part of the spiritual aspect of the journey too. This week I'm flying out to Montana with a bunch of close family and friends, and doing a hiking, climbing, backpacking trip in Glacier. I find it, I don't know, I'm just really happy and blessed to be able to be here, to be strong enough and healthy enough to strap a backpack on my back 3 years into treatment and go climb mountains. I mean, it doesn't get any better than that, honestly. I'm so happy for that.
Yeah. Well, thank you so much, Rick, for sharing your story. You are a blessing to this world. May God bless you forever and ever, and your family. And thank you again for sharing your story.
Thank you so much.
Hi, my name is Elisabeth Mack, and I welcome you to this webinar for Americans for Safe Access on cancer and cannabinoids. My declarations: I am the founder of Holistic Caring, based here in California, and this material is for educational purposes only, not to be construed as medical advice. Please talk to your team about incorporating all holistic care into your approach on managing your illness. Cannabis is a marvelous plant. It's one of the things I like to talk about all day. And just to relay the safety of using it as a medicine, it has been used over 5,000 years in humans. There are 500 natural compounds in this plant, and we call them cannabinoids, terpenes, and flavonoids. And the medicine is in the trichomes. So the thick purple, sticky, stalky substance, that's where the good stuff is in this plant. And you want to use medical formulations that are made from the flowers of the cannabis plant. Cannabis is something called pleiotropic. And why I love that word so much is because it gives us very effective efficiency to address many conditions at once. When we take cannabinoids into the body, we can deal with helping with pain and sleep and anxiety and depression, lifting mood, lifting energy, quenching nausea and vomiting, and helping inspire appetite, and helping get a good night's sleep. So that's what I mean by pleiotropic. It is such a wonderful drug that we can use to help supplement our own endocannabinoid system, because the phytocannabinoids from this plant actually mimic the endocannabinoids that you are making on a daily basis. You have cannabis compounds in your body right now. And I like to explain that with a quote from Vincenzo Di Marzo, an Italian scientist that coined the term eat, sleep, relax, forget, and protect. And the endocannabinoids are manufactured on demand in response to stress to regulate the cells and how they communicate internally in your body. So the endocannabinoid system is a master regulatory system that flows through the brain, the central nervous system, cardiovascular, neuromuscular, the immune cells that are regulating and keeping checks on cancer, and then all of the GI and the digestive issues that are going in your body. And so now you understand pleiotropic, and it's not snake oil. When you put cannabinoids into the body, they are able to help you bring back homeostasis or balance at the cellular level, helping you feel better and helping you function. And when we have diseases like cancer, the endocannabinoid system is broken down. It's not regulating things. It's not keeping things in check. So let's take a quick look at what happens with cancer. Cancer is a disease of overgrowing cells affecting everybody without any boundaries. And when cancer cells are created, they lose their off switch. They lose their ability to regulate growth, and they multiply, divide, and cause DNA mistakes, causing these abnormalities. According to the American Cancer Society, 50% of all men and a third of all women will develop cancer at some point in their lifetime, and there are over 200 different types of cancer. Cancer spreads through the lymphatic and the circulatory systems, so people can develop secondary cancers in other sites that are unrelated to the first. And sometimes you might treat one type and then it comes back as another type later. Well, how do we treat cancer in conventional medicine? Normally, we look at can we do surgery on it? Can we start to remove some of these cancerous cells and stop it from growing that way? Can we use chemotherapy to basically poison the cancer cells and get them to die off? Can we use radiation, high energy gamma rays that will destroy and break up the tumors? And targeted therapies where we can send medicines into the body that are going to seek out and try and destroy just those cancer cells, which is always favorable. And then immunotherapy, boosting the patient's own immune system to fight and battle back to shrink these tumor cells. So we have side effects with no matter what type of treatment you're going to have. And these are a list of some of the common side effects that patients are struggling with and what we need to treat generally on the cannabinoid side in mitigating some of these side effects so that we can, again, get people to eat, sleep, relax, forget, and protect, and to try and help them tolerate the treatments from these other cancer options. So what about cannabis? Well, the lab director for Aunt Zelda's, one of the premier oil makers here in California for many years, published a book on cannabis for the treatment of cancer that you can get at Amazon, where he really breaks down what apoptosis is, or the ability to get the cancer cells to turn off. See, all of our cells have a start date and an end date, and cancer cells mutate and lose that off switch. And what we're trying to do with cannabinoids is to get a certain potency into the body so that we can re-trigger those cancer cells to die and to go away and go through digestion. And when we use phytocannabinoids, the phytocannabinoids from this plant, to try and right the ship at the cellular level, that's what we're trying to do. And in preclinical data with cell cultures, we are finding that cannabinoids from the plant exhibit strong anti-cancer properties. Now, we are still in the preclinical days of knowing how to do this, but as far as the research, we are able to see that in cell cultures and some rodent studies, that we are able to re-trigger these cells to die, apoptosis, take away the blood supply and inhibiting them from getting nutrients so that they can't grow that way, and it's stopping them from spreading, having some anti-proliferative effects. So again, we're not able to really study this with humans directly as we want to in clinical trials, but we are able to look on the palliative side that people are using cannabinoids so that they can eat, so that they can not be vomiting and nauseated, so that they can get a good night's sleep, which helps them restore. And sleep, that is where your immune cells are rebuilt and your body is healing. To reduce pain so that you can be able to be active and continue to live life as normally as possible, and reducing anxiety and helping you be able to tolerate the other treatments and be present with your family. So that is the observational data. The Academy of Science and Engineering published a report back in 2017 saying that there was conclusive evidence that cannabinoids act as antiemetics, like your Zofran, being able to squelch down the nausea and vomiting. And we are also seeing a dronabinol or marinol, synthetic THC, be prescribed by conventional oncologists because THC is such a good antiemetic drug. So we do have conclusive evidence that it is helpful. And the folks that created Sativax, which is made by GW Pharmaceuticals in the UK, showed that in a phase 2 trial that they have a 1-to-1 combination CBD THC medicine called Sativax, that it was enhancing the performance of Temodar. And when they gave it to the patients that also had glioblastoma, that they were able to increase the survival time by the people that were taking the Sativax as opposed to the people on just the Temodar alone. So it might have an additive effect. And when we are thinking about using cannabinoids in clinical care, please always use whole plant botanical formulations because they do have much more significant anti-tumor, anti-cancer properties. In this study, we found that the botanical formulations affected more targets and mechanisms of action than pure THC. And combining the cannabinoids with the other tamoxifen and lecanemab, respectively, that it was able to have an additive effect on the cell cultures that they were studying. So when you take just THC versus whole plant botanical formulations, the whole plant bested the pure THC. And Tikkun Olam is over in Israel. They have patient-centered care that they are running with, also making the formulations in Israel. They have much more acceptance of cannabis in clinical medicine. And they studied their midnight and avetical strains with 2,970 cancer patients. And they found that after 6 months, 95% of those reported improvements in symptoms. 70% said they had a better quality of life. And 53% when they started the treatment were complaining of pain scores over 8 on a 10-point scale. And after treatment, only 5% of the patients were rating their pain at an 8 or higher. So much better pain control. And many of the people were able to quit opiates and eliminate other pharmaceuticals as well. When it comes to using cannabinoids concurrently with immunotherapy, people ask about that. And what basically we're trying to do with immunotherapy is to stimulate T cells to work again and to really target the cancer in the body. So we're revving up the immune system and trying to increase inflammation in the body. And when we're using cannabinoids, they can be immunosuppressive and anti-inflammatory effects. So if you are taking immunotherapies, please make sure that the THC is 20 or 25 milligrams a day or less, just using it to help with symptom control of some of the nausea and vomiting and pain, but not in high doses. And then with chemotherapy, we're finding that many of the cannabinoids can work in additive or conjunction with the chemotherapy and play nice together. So some of the receptors for cannabis are also found right next to the receptors for the cancer. So when we send cannabinoids in there and they bind, some of them are creating a little dimmer that is really going to help accentuate the chemotherapy. And so maybe using them concurrently is good for some chemotherapies, but not for immunotherapies. Patient-centered toolkits of healing. That's what these medicines are. It is a way to empower patients to take back some of the treatment plan on their own shoulders and have some self-direction. And so it gives you a sense of control and helping patients figure out CBD, THC, CBG, CBN, how to use these in conjunction with some of the terpenes, daytime dosing, and nighttime dosing, which is where you add the THC, is the way forward. And that this is not just about hitting a receptor and trying to accomplish a response, but it's body, mind, spirit healing. This helps improve coping. This helps open up your spirit and get you laughing and remembering what life is all about and savoring each day when you're not feeling so sick, when you're feeling like you can take on the world as more of who you are. That is what we're trying to accomplish with cannabinoids and cannabis therapeutics. And cumulative dosing is what's going to heal. It's not just where you start something and try it for a week. No, this is a pathway there that you have to really try and stick with, but it will be successful for you. When we're talking about CBD and THC, I call them the power couple. CBD can help soften the effects of THC so it's not intoxicating, and then THC can help enhance the efficacy of CBD. So it's really not one or the other. It's an and ratios and breaking up how to take CBD and THC together is really the way forward. And here at Holistic Caring, we're trying to change the narrative with education. Medical patients need to learn that it's not about recreation. It's not about getting high. It's about setting an intention, learning the different products, and then working on a dosing schedule to really heal. You have an endocannabinoid system. We're going to activate that system with these compounds. And when we have deficiencies, that's why why people get ill and they get sick. So we teach people about the differences between CBD and THC and the minor cannabinoids and terpenes, how to start a safe supplementation treatment plan, starting points and what some of the dosing ranges are, that there is flexibility through all the different routes of administration and use, and that you should be able to sit down and time the dosing of the cannabinoids with the other pharmaceuticals that you're taking, managing interactions, tracking results and efficacy, and then setting expectations. There is a lot of flexibility when it comes to taking cannabinoids as part of a cancer therapy approach. You can vaporize, and that has an immediate onset of action. You can, and a very short duration. You can take edibles and capsules that have a long onset, a prolonged onset of maybe 30 to 60 minutes, but a longer time of use and how they work in the body. And then tinctures, which is my favorite way to get systemic access of the cannabinoids into the bloodstream, really traveling throughout the body, having the best bioavailability, and where we can start to escalate the dose, but still really control the pathway with CBD oils, CBG, CBDA, THCA, THC, CBG, and all of the different things that you can get with tinctures. Of course, topicals are good for localized relief and healing. Some minor skin cancers can respond to topicals, and it can be very calming and soothing where things hurt or if there's radiation burns to try and squelch that. And patches can give some long-acting continuous basal dosing to get into the system on a regular basis. And some people with local issues are using suppositories. I'm not necessarily thinking that they're going to be in the systemic circulation the way tinctures are, but suppositories do have a place in the treatment plan for some people. When we're talking about dosing with high therapy oils, lung, liver, brain cancer, skin cancers can take a little bit more THC. Some of the endocrine-driven cancers, breast, ovarian, uterine, prostate. We want to lessen the degree of THC being used and a little more CBD and CBG. And a lot of the clinicians think that it's best to dose CBD separately from THC because CBD is a flush of antioxidants, cleaning and resetting, neuroprotective, anti-inflammatory, while THC really activates those CB1, CB2 receptors directly, really helping to reset the genes in the preclinical data that we're showing. So I like to dose them separately, CBD in the day, THC in the evening and bedtime, and then monitor and switch your ratios every month or so. This is something where cause and effect are quickly correlated, and people need to be adjusting these. But when we're talking about high dose oils, a lot of people have heard you have to take a gram a day of oil for 90 days and you're going to be free of cancer. Well, it doesn't really work that way. You don't need a gram a day. You need good quality oils. And we try and target about 5 milligrams per kilogram per day. So if you see 150 pounds, 68 kilograms, that's going to be approximately 340 milligrams per day. And then you split that between CBD in the mornings, maybe some of the acidic CBDA and THCA and CBG, if you can find those in the afternoon, and then the THC at bedtime. That seems to be a good, sane approach that most people can implement and stick to. And again, always adjust your plan. So side effects and safety, CBD can cause some dizziness and jitteriness and fatigue. It can lessen appetite. THC can have those same types of effects, but can cause some disorientation. High dosing can cause anxiety and paranoia and some hallucinations. So we want to give THC at bedtime, and hopefully you can sleep through the intoxication. There can be lower blood pressure and blood sugars, so make sure you're hydrated and well fed. And when you're dosing, these medicines, the cannabinoids, do interact with the liver and other pharmaceuticals. So spacing at least an hour apart from some of your other pharmaceuticals is best practice. There is potentiation and grapefruit interactions. Taking within 15 minutes of food helps boost the bioavailability and giving patients a better response and less changes to blood sugar. And then start low, go slow. This is not a race, just titrate up slowly, aiming for that 5 milligrams per kilogram and holding for at least 90 days. And you acclimate to THC in a couple of weeks, usually 10 to 20 days. You really sort of feel like you get the hang of the THC. And then just really hold this for at least 90 days. But most people take a treatment plan for about a year with a maintenance dose built in and maybe a maintenance dose forever. I always tell patients, please talk to your providers about using cannabis. That they understand that you want to use it and it affects the other medicines that are on board that they're managing, and they can adjust dosing because you might not need so much of the anti-nausea medicines and the appetite stimulating medicines and the pain medicines, and you can wean down some of the opiate dosing, and they need to manage all of the prescribing on their side. So please be honest with this. They understand. And all of your treatment plans should be discussed openly with them. Make sure that all of your medicines have a certificate of analysis so that you know the potency and the purity of these oils and tinctures that you can be taking. And just really think about interlacing all of these different dosing strategies. It's not just one thing or the other. You can vape some CBD or a 1-to-1 oil for some breakthrough symptoms for immediacy. You can use some microdose edibles to have some long-term pain management and help sleep. You can use tincture, of different ratios and targeting 20 to 500 milligrams a day. And some people can get the fully extracted cannabis oil in the syringes, but really think about CBD in the day, THC at night, and topicals for comfort and to reduce inflammation and pain, and patches if you have access to them for long duration dosing. So some quick key takeaways Cancer threatens the life and functioning for many of us, and patients need all the help that they can get. We are hardwired to respond to these cannabis supplements with the endocannabinoid system that can respond to them. And these cannabinoids are anti-cancer. They're antioxidant, neuroprotectant, anti-inflammatory, analgesic, antidepressant, anti-anxiety, anti-insomnia. The list goes on and on. Cannabis medicines are safe. They're dosed very flexibly, and they help people with coping. Please follow the manufacturer dosing information in the protocols and find a cannabis clinician to dial in this care professionally. And be hopeful, be realistic, and monitor and adjust your dosing based on the outcomes that you're seeing, and always be flexible in your approach. So I like to close with this. If you change the way you look at things, the things you look at change. We have been stigmatized against cannabis for the last 100 years by prohibition, and all of that is starting to fall. So please look at cannabis as something that is a part of your treatment plan that can supplement and boost the efficacy of everything else you're doing. It helps with body, mind, spirit, medicine, and stronger self-care, the ability to eat, the ability to sleep, the ability to rest and restore. All of that can be enhanced with microdoses of cannabinoids done right. So thank you and God bless. I do like to say tikkun olam, we can heal the world. Cannabinoids are just part of the treatment plan. So let us know if you have any questions. Visit us at holisticcaring.com, and please visit Americans for Safe Access and read all of the literature they have there that you can go deeper and to be able to study more on your own. So thank you very much, and God bless.
Thank you so much, Elisabeth. That was amazing. Thank you, Jessica and Rick. Before we go into the QA, is there anything you wanted to add, Elisabeth? We got a lot of good questions during the session.
Yeah, we did. And thank you all for putting up with the quality. I put in the chat that Rick was out in the sticks in Wisconsin, and he has really spotty reception. But overall, I'm just thrilled to have an audience that wants to talk about this and to understand that we are educating, equipping, and empowering patients across the globe, not just here in America, to really incorporate cannabinoids into conventional care as much as possible. And as Rick mentioned so many times, it is an and, not an or. So one of the first things I always like to tell patients is, don't think you're going to do this with just cannabis oils. We're going to use everything concurrently and make you have the best way forward. So it's always an and. But let's see if we have any more questions to see if we can go live.
Well, and I also wanted to mention real quick that it's interesting. Someone asked when Rick's interview was, and Elisabeth answered it was just last month, but because he said it was hard for him to find a doctor, or no doctors would recommend cannabis, they thought that was very interesting. And no matter, depending on where you live in the United States, that's very common. It's
Right.
very common for doctors not to want to talk about cannabis as an option for symptom relief. So it does happen a lot.
Right. And there was another question in the Q&A about, what if you can't access THC? If you're not in a legal state, well, gosh, you could still order really well-made CBD oils and oils that have other terpenes and CBG and CBN. And, so always start there, first of all, because these cannabinoids all have, one, anti-cancer properties, and two, the ability to reduce symptoms and to help with some of that nausea and vomiting. I saw another question talking about Delta-8. So Delta-8 is all the rage nowadays, right? Because it's part of hemp, and they're able to take CBD and formulate it so that it becomes Delta-8 in a way. Delta-8, Meshulam has some early science analysis of Delta-8 being almost better than Delta-9 for nausea. So when we're talking about cancer, Delta-8 might be something that you can get in gummies nowadays. You can get it in vapes. And if you do have some cancer symptoms of nausea, it might be something that is good to fold in, and most people have the ability to order that nowadays too. So let's see. Just to close out on immunotherapy, there was another question about immunotherapy and, what concurrently and the different types of immunotherapy to use. Some of the early research out of Israel does show that the immunosuppressive abilities of cannabinoids really can interfere with immunotherapy. And so it doesn't necessarily matter the type of immunotherapy. The take-home message is to keep the cannabis dosing low so that it's just seen as a symptom management. 5, 10, 20 milligrams should be okay, but really don't look at, using 500 milligrams or 300 milligrams of cannabis oils when you're using immunotherapy, because you really want to work in conjunction with what that is targeting to do. And then just, always think about this as, when Jessica said it can be economical, think about the pharmaceuticals that you're using that cannabinoids might be able to help you, reduce dosing on, saving money and also saving side effects, right? So medicines for pain, we can wipe out NSAIDs and opiates, medicines for nausea and vomiting. So we can take away some of the medicines there, like Zofran. Medicines for appetite, to stimulate appetite. So that's what they're using Marinol and Dronabinol for. There are many cancer patients that are getting those prescribed, but the psychoactivity of the Marinol is sometimes too much for people to tolerate, especially people in their 70s or so. The natural THC option is going to be better for them. Sleep, being able to take away some of the Ambien and other hypnotics, which can be very dangerous, especially for older people, and falls. Low doses of THC might be able to help usher in better sleep, and anxiety. People using all of the Ativan and Xanax, in conjunction with cancer treatments. Think about all of those drugs. And Don Abrams from UCSF, really says, I could prescribe 5 drugs for you, or I could get you, a recommendation for cannabis. What would be better? And this is the conversation that we need to really have as Americans, talking about, how to interlace this with conventional care more, so that patients really have autonomy and agency to make their own decisions and look at what's better for them. Across the board, as far as symptom reduction, potential anti-cancer properties, and a better economic impact for them. So any other questions? Let's see.
Well, what I do have, someone asked, what do you recommend to patients who want to raise the topic of cannabis with their oncologist, assuming the oncologist isn't specifically educated on cannabis? And you did mention a little bit about that in the end of your presentation, and I'll let you expand on that. But I do want to mention one resource that we have on our website. If you go to safeaccessnow.org and you go to medical under patient resources, there's a talking to your doctor section. And there's a letter there that you can give to your doctor that might help bridge the conversation about cannabis and, helping your doctor. I always encourage patients to talk to their doctor, even if the doctor doesn't want to hear about it, because we need doctors to know this is something patients are going to ask for, whether you like it or not. And as a doctor, it's their responsibility to listen to their patient and to learn about what the patient wants to try. So we do encourage you to talk to your doctor.
Yeah, and when I'm encouraging people to talk to their doctor, I tell them, I need you to adjust your side of the treatment plan, right? So make sure that they're cognizant that there could be reductions in dosing of the pharmaceuticals that they have to really take ownership of. And B, let's have a wider lens. Let's look at this from an integrative standpoint. Don't you want to have all of my best outcomes, in mind when you're working with me, right? Because it's not just about what you're doing. It's about me as a whole person and needing other options and needing to have more of a complete dialogue rather than just using you. Yesterday morning, I had a new patient appointment, husband and wife, 47-year-old, man chiropractor in Colorado, and was always living a healthy life. Didn't smoke, didn't drink. Was a mountain man, managing weight and eating basically a paleo diet for forever. And you know how he got cancer is it just happens, right? But the wife is like, we're only going to the oncologist so that we can have him manage the labs and the scans, so that you know we can do everything on our side. And not even having that concurrent dialogue about what is really best for this man. And that has to stop. You know, in 2021, where we have 37 legal states, with 19 being able to access adult use, we should be able to have our oncologists look at this with an open mind, and not say, you know, I'm only going to take care of the chemotherapy, and that's what I'm going to insist on, because these patients are voting for other options on their own. And it's just horrible that people really feel like they can't go to their oncologist and be upfront and honest about everything that they're doing. So, you know, advocacy needs to continue.
For sure, for sure. I mean, it's your body, it's your choice. And yeah, definitely don't be afraid to talk to your doctor about utilizing cannabis in your treatment, for sure. Is there any more questions, Elizabeth? And again, please feel free to put them in the chat, in the Q&A.
Okay, so there's one question from Norm Goody. How do we bill for patient visits? So we have a invoice, but basically it's all cash pay right now. So I did spend my first 10 years in hospitals and the next 20 in insurance companies. So I am going to go back to the payers and ask them to expand services so that people can have a cannabis clinician to be able to guide them through this. But right now things are kind of cash pay. But, you know, as far as giving them an invoice for the bill, they can take that as a super bill and submit that to their insurance. In fact, more coverage is expanding in options to give patients more choice. So if you do have a progressive insurance carrier, you can submit a bill, and some of them will reimburse for the visit, as well as some FSAs allowing for CBD to get through in their flexible spending account for pre-tax dollars to be spent for CBD as well. So we're hoping, you know, that again is more advocacy that's going to be needed, but I hope to play a role in that as well.
And I really appreciate that question. It's a really important issue because patients are not only paying for the medicine out of their pocket, but they're often paying for the doctor visit out of their pocket as well, and of course the medical cannabis card. So we are trying to fix that. It's one of our issues here at ASA that we really want health insurance companies to pay for this, and that's why we have to see it as a real medicine. It is a real medicine, and that means insurance needs to cover it.
Yeah, and you know, I mean, with such versatility that this plant has, and so many flexible routes of administration and dosing options, you know, there's really no wrong door. Patients can start somewhere and figure this out. And you know, they need to understand that they truly are the captain of their own ship. So many people just give away their power, especially if they're sick, and they just, you know, do whatever the conventional oncologist tells them to do. And as Rick alluded to, you know, you really need to seek out an integrative oncologist and to have a team approach so that it's not just one person telling you what to do. So always step out and look for that wider lens of treatment options, because cannabis plays a role that is more and more a critical point that patients need to continue to bring up with their providers and to push for in their own path forward as a whole person seeking whole plant options. So I think that's it.
Yeah, if there's any more questions, please just put them in the chat quickly. Otherwise, I just want to say again, a big thank you to Rick and Jessica for sharing their stories, powerful, powerful stories, and Elizabeth for sharing her knowledge. I want to do a shout out to Tasha who is here as well, Tasha Jackson, who's part of Holistic Caring and an amazing educator as well. I want to say a big thank you to our sponsors again, Weed Maps and Dr. Bronner's, for supporting us in our mission and advocating and helping us advocate for patients. I want to thank everyone here who joined us today as well. I know we all have busy schedules, so thank you for taking time out of your day to join us today. We really appreciate it. This recording will be on our website probably next week, and everyone who is here, we will send you a link to that so that you can watch it again if you missed some spots, or share it with your communities. And again, if you liked what you saw here today, we encourage you to become a member of Americans for Safe Access. It is only $35 a year to become a member. And we actually just recently partnered with a new magazine called Cannabis Patient Care, and their very next issue that's coming out in October will focus on breast cancer. And all of our members will be receiving a free subscription to that magazine. So if you sign up for that, you'll get that issue for free. And we have a few more member benefits that we are going to be sending to our members shortly. Any final words, Elisabeth?
Well, it was an honor and privilege to be here. Please visit us at holisticcaring.com and let us know how we can help you. And please support Americans for Safe Access. Become a member. Go to their condition library and stack up on your knowledge, and just really be hopeful that this is the year for more legislative advancement and for more inclusive conversations within conventional healthcare and cannabis therapeutics. So thank you very much. Thank you, Debbie. Thank you, Jeff, for the platform and for the time. And thank you all for attending, and God bless you.
Thank you. Bye, everyone.